Dear friends, many people have asked me to make a statement on how we are and how things are going regarding the corona crisis, the worldwide crisis, but especially how things are going here with us in Mandeni. First of all, I want to tell you that the Department of Health has issued the newest statistics yesterday on the 31st of March as 1,353 infected people nationwide. Out of these, 179 are from our province, KwaZulu-Natal. I'm only aware of less than 10 infections in our own magisterial district of Ilembe with capital Gwaduguza, and one case here in Mandeni, and 5 fatalities in the whole country. Our Minister of Health has prognosed that 60 to 70% of the entire population of South Africa, which is around about 59 million, will become infected with corona. And that would, in plain figures, mean around about 40 million might become infected with the virus in our country. The South African Center for Epidemiological Modelling and Analysis expects between 87,000 and 351,000 people to die from COVID-19 infection. We are all afraid of this tsunami wave of corona infection, which is still going to hit us eventually. Our big problem is that many South Africans live in very overcrowded townships and informal settlements without the ability of social distancing. If you are in a hut, 10, 15 people in a small room, you cannot have social distancing. Many will not even go for testing, nor be diagnosed nor treated, as it happened initially with HIV and AIDS in South Africa. 80% of the population of Mandeni, which is round about 250,000, live under the poverty line. They have no means for panic buying and may live on the old age grant of their one granny, a whole family. And when this is paid out now at the month end, the shops in the stores are already quite depleted by the panic buying of those people who had the money. Even now we have problems buying disinfectant, face masks, gloves. Our suppliers have promised to deliver once they will have received their stocks, but thinking of face shields, protective clothing, or shoe covers is just a dream. Our South African health system is not geared for such a pandemic and can only do what is in their power. We are very proud, though, of our personnel. They continue to render their service very faithfully, claiming, "I cannot stay at home, I'm a healthcare worker." And I have highest respect for that. We are responsible for a full house of 40 immunocompromised and frail geriatric patients here in our hospice, and their lives are most endangered by the imminent infection wave. We supplied close to 700 patients in our AIDS treatment program with antiretroviral medication for 2 months. Therefore, we can safely say they can stay at home and get what they need to survive. Our home care program, though, had to be disrupted. We only can attend to emergencies at the moment, and the personnel of our home care teams is now strengthening the ranks of our personnel in the inpatient hospice. Our children's home is full with 55 children, and a good number of them have previous conditions that make them especially vulnerable. We have to look after them, and I must tell you honestly, it's actually wonderful how our caregivers and how our educators are keeping them occupied, doing homework and doing schoolwork and doing leisure activities with them, like if it was in holiday time. Well, it is a prolonged holiday, if you want to say like that, but of course they have to learn, and it is wonderful to see how it is happening. Our malnutrition clinic had given out baby food for the expected lockdown period as well, so those mothers don't have to come, or those caregivers don't have to come to collect their food. And of course our pre-primary school and creche is closed, but that's not a big problem because their mother or their parent is anyway at home because all the factories and companies are closed, and so the children are looked after because the parents are not going to work. One very big problem for us is that, as you know, we have to finance our entire work through grants and donations. We are not selling our services, and we are looking after people who are so poor that they could not even pay €1 a day or contribute in any other way. So we have to finance it ourselves. But our fundraising is severely challenged because we are restricted to electronic means of fundraising. The South African Post Service has closed down. They are neither transporting letters in or out of the country, or not even locally. And we are therefore most grateful for donations that we get. And we ask you to go into our website bbg.org.za, and you will find a link there to send us donations. Also on Facebook we have made a big donation appeal, and if you are using PayPal, you may use my email address father@bbg.org.za to send us a donation. We are determined to help as much as we can and will continue our charitable work by all means. We don't give up, and we will carry on as good as we can. We want to remain united in prayer with our friends. I am celebrating Holy Mass now every evening at 7 p.m. South African time, which is at the moment the same time as in Central Europe's summertime. I do it here next door in Blessed Gerard's Chapel. And these services I am streaming online on our YouTube channel. And if you go to YouTube and look for Father Gérard, without space between Father and Gérard, and no H in Gérard. So Father Gérard in one word, that is our YouTube channel, and there you can listen and look at our services every evening at 7 p.m. I thank you for all your prayers. I thank you for all your moral support, and I thank you for all your donations. Please help us also in future. Enable us to do what we have to do, and I thank you wholeheartedly for all your support and for all your friendship. Thank you very much. Yours in Christ, Father Gérard.